Doctors detected the first case of COVID-19 in South Africa earlier this month. Over the past 2 weeks, more than 150 people have been treated for the virus. As the government tries to contain the outbreak, many are worried. 28-year-old Tsepo Ngwato is one of 7 million South Africans with HIV. He says with an already compromised immune system, his priority is to keep safe.
It feels like it's another HIV reload of a sort, that we are actually re-evaluating something that has got a lot of fear towards people living with HIV, because we are in that denial of saying, what if I get infected? What's going to happen? What are the issues? What's the next steps?
Millions like Tsepo have no option but to use often overcrowded public transport. While private taxi operators have promised to disinfect and provide hand sanitizer, many have been slow to implement the new guidelines. Public hospitals and clinics are normally crowded, with people waiting for hours to see a doctor. There are concerns the coronavirus could easily spread.
When you come to our part of the world, our public healthcare systems are broken. Our intensive care units are full even before we get to COVID-19. So again, there's a real danger, and this is why I think we need international support for Africa. We need a mobilization of resources.
Poor water and sanitation infrastructure in parts of South Africa mean that many may not be able to wash their hands as often as they should, increasing the risk of contracting COVID-19. In upmarket suburbs like this one, homes and spaces are large, streets are wide. It's easier for people to keep apart. But for millions of others, the reality is quite different. Thousands of townships across South Africa are overcrowded. Dozens of families share one toilet. Streets are lined with rubbish, and people have little, if any, space to themselves. The government is using TV, radio and the internet to spread awareness as quickly as possible, and has promised quarantine spaces for people who don't have their own. It's closed schools and banned gatherings of more than 100 people. Compared to Europe and Asia, African countries have fewer reported cases of the virus, but some experts worry that poorly equipped public health systems are failing to spot the true total, and warn the continent should prepare for the worst. Fahmida, Jazeera, Johannesburg, South Africa.